Welcome back to another episode of hMPV, a common yet unknown respiratory threat. On the last episode, with Dr. Peter Oppenshaw, we addressed what human metapneumovirus is, or simply referred to as hMPV, how it spread, common symptoms, long-term impacts, and burden of disease among older adults, overall setting the stage for addressing this as a respiratory disease of concern. In today's episode, we hear from three different perspectives: healthcare providers, patients, and caregivers. Each guest shares their story and perspective on the impact of respiratory diseases, including hMPV, on people's lives. It is important to note that while today's interviews focus on at-risk adults living with chronic diseases who are at greater risk of severe complications, hMPV has the potential to affect all older adults. Let's begin today's conversation with Dr. Melissa Andrew. Well, welcome, Dr. Andrew. I'm wondering if you can just start a little bit by just telling us about yourself and your role and your expertise.
Sure. My name's Dr. Melissa Andrew. I'm a geriatrician in Halifax, Nova Scotia, with an interest on infections in older adults and how we can use vaccines to prevent the adverse outcomes that come from these illnesses.
And can you describe a little bit of your experience diagnosing and treating hMPV?
Sure. That's a tricky question, actually, because I would say that in general, most places do not test routinely for hMPV. So that means that a person could come into the hospital and even have severe illness, but we would never know unless we actually do the test. So I have had some patients who happened to have testing because the policies of the lab were such that a broader panel was sent for respiratory viruses. And in those cases, these patients, I would say, were indistinguishable from patients who had other respiratory viruses that we may be more familiar with, like RSV or influenza. And so essentially these, in the cases that I saw, were older people, usually with underlying chronic conditions, and they were admitted with some acute respiratory type illness, which could be quite severe, requiring oxygen, and sometimes even ending up in the ICU.
And you sort of mentioned that, a lot of the people that you've seen with hMPV are older people, people with underlying medical conditions. So can you talk a little bit about what factors may contribute to the severity of an hMPV infection?
Sure. We had the opportunity to do a research study looking specifically at this issue. In fact, we went back and tested a sample of several thousand patients who had been admitted with acute respiratory illness over a number of years. And we went back and tested them using their samples using a multiplex test that included hMPV. And so what we were able to identify in that systematic research study was that about 3 or 4% of the patients who were admitted to adult hospital with acute respiratory illness did have hMPV. And interestingly, their outcomes were fairly similar to some of the other big names that we hear in this space, like RSV and influenza. The mortality might be a bit less. So in our case, we saw about 3% or 3 out of 100 of these patients died when they had hMPV, which is still substantial, but maybe a bit less than RSV and influenza. However, we did find that 10% of the patients with hMPV ended up in the ICU and had prolonged hospital stays with other complications. And the biggest risk factors, or the three big groups who ended up with severe hMPV illness, were these. One was COPD, people with underlying COPD. The second was people with underlying congestive heart failure or chronic heart conditions. And the third really big group is people who are frail, so older adults living with multiple health and functional conditions that make them frail and more vulnerable to these infections.
Our next guest is Mr. Radu Costin Ganescu, who provides more insights into the patient perspective, and we'll start off with discussing his current role and work.
So I'm Radu Ganescu. I'm a patient. First of all, I have a rare disease, a thalassemia major, and I'm also very, very involved in civil society. I have a small patient association with our pathology, with patients that suffer from this disease. And also, for the moment, I am the president of a national coalition of patients with chronic disease, who is a member of European Patient Forum. So from that direction, I am member in the board of European Patient Forum.
I'm wondering if you can share a little bit about what motivated you or to become involved in this type of work, and if there's any kind of, personal connections or stories that you would feel comfortable sharing.
I started 20 years ago, and it was for the first as a start was a personal decision because it was needed in my community to have access to new treatment, to innovation, and in order to do that, we needed to have a patient organization, practically to be a juridic personality. So I start with other patients to have this organization and being a partner in dialogue with doctors and with the scientific community in order to put pressure in the authorities to reintroduce in Romania some treatment, innovation treatment back then for our community. So this was the start practically.
So I want to just ask about hMPV specifically, and if you think that these patient populations are at all aware of hMPV specifically.
I must say that not fully aware, and especially in respiratory virus population, they probably have a flu or I don't know, something with the throat or things like that. They don't have the, let's say, the education to understand that could be a virus or could be something infection or something else. And that's why we try to recommend that not to stay home and treat themselves, to go to a hospital, to a doctor, in order to see exactly what it is. If it's something that can be complicated, immediately to go to treatment and have access to treatment. So it is a lot of work to do in this area. And we know that some of the respiratory infection can give you some future chronic disease for patient with asthma or patient with different pneumonia infection that could remain chronically. And that's why it's important that the citizen, the population, to understand and go immediately to the healthcare services, to doctors.
I think that's kind of a great point that you make in some of the long-term impact of these diseases on this patient population. So can you talk a little bit about just the overall impact of any kind of, respiratory disease, whether it's flu or COVID or hMPV, on this patient group in terms of their long-term health and in terms of their kind of long-term quality of life?
In long term, probably as a chronic patient, develop a respiratory infection with complication, probably you'll have another chronic disease or another comorbidity that could put your health or your life in danger. And we saw that in the pandemic time when a lot of chronic patient with different disease like heart disease or obesity or diabetes type 1 or type 2 had very ugly complication with COVID, and many of them even lose their life because of this infection, respiratory infection. So there is a lot of impact in the community, a lot of impact, especially in chronic patient and in elderly one, vulnerable group. So that's why it's important for us to send a message to try to prevent this and to try to be vaccinated in order to avoid complication or avoid even the infection.
And can you talk about just a little bit about how kind of meaningful it is to actually be engaged with the patient and be engaged with people, and how does that kind of advance your work in actually hearing from the voices of people really affected by these conditions?
being involved with the patient is very important because it's how you change things. We cannot change
Yeah.
things from staying in the office or staying in the building of the government or whatever other institution. You have to go back in community, work with the patient, discuss with them, and ask them what their problems or what they need and how to be involved.
Our final guest is Ms. Tonya Winders, who provides insights into the patient and caregiver perspectives. So, Tonya, can you just start off maybe by telling us a little bit about yourself and your background and your role?
My name is Tonya Winders, and I'm the president and CEO of GAP, the Global Allergy Airways Patient Platform. We are 150 patient advocacy groups, specifically in immunology and respiratory, all over the world, doing work to raise awareness of these conditions, but also to educate patients, caregivers, and healthcare providers in this space. And then we also do some policy advocacy work and research in the space as well.
So are there any kind of stories or anything that jumps out at you that really highlights kind of the concern or the barriers that this patient population faces?
Well, I'll actually use my own lived experience. So I'm the caregiver for two people in my circle. One is my mom, who has been living with COPD now for about 6 or 7 years with her diagnosis, but she had the symptoms for far longer than that. And the second is my dear friend, Miss Carolee, who's been living with COPD for now about 11 or 12 years. And I just had a phone call yesterday with Miss Carolee, and she said, I'm basically homebound now. I'm, restricted to the 4 walls of my apartment because I'm scared because of my advanced COPD, because of the risk of infection of, pneumonia, but also colds and RSV, hMPV, like all of these things that she didn't know what they were. She just said a bad cold that would turn into pneumonia or turn into an exacerbation of her COPD and land her in the hospital. And so at this holiday season, she's going to be sitting alone in a very small apartment for most of the holiday season and the winter, just trying to stay well.
How can this respiratory disease season be particularly challenging for individuals with these types of conditions? I wonder if you can go into a little bit more detail.
So we know that if you're living with compromised lung health or compromised immune health, that you are much more likely, right, at a greater likelihood for complications from just a cold. Mm-hmm. So, or from, any type of respiratory virus. So, think back to 2020, 2021 with COVID. We knew that, again, those people that typically ended up hospitalized and even those that died, unfortunately, had some underlying comorbid conditions that made them higher risk or not as likely to recover. And so, again, that's anyone who's living with compromised lung health, so asthma, COPD, heart disease, all of those things tend to make you more susceptible to complications, but then also compromised immune health.
Can you talk about what awareness in this community might be like on hMPV?
So honestly, to this point, I think most people have no idea what hMPV is. They probably haven't even heard it. And to be honest, even though I'm in the space, I didn't know very much about it until a few years ago when someone that I love actually did get it and ended up in a flare of their COPD and ended up hospitalized. And it was just because the pulmonologist actually did an expanded breadth of testing that we even learned that it was hMPV. So the awareness is very, very low. And if you look again across Dr. Google and the internet, very limited resources on this.
Now, as we wrap up our conversation, we wanted to highlight some key takeaways our guests have identified.
Well, I think that, again, we covered so many of the bases, but oftentimes individuals that are living with compromised lung health or immune health are in underserved populations, right? They maybe have lack of access to good quality care. They may not have primary care, good basic relationship with a primary care provider or a medical home. And so it's ever more important for that community to listen to your body, to be very attuned, to take the necessary prevention steps that we've talked about. But as soon as you are in that thick of it, right? If you're on day 2 or 3 of symptoms and you feel yourself getting worse, right? So your underlying condition, asthma, COPD, or any of the others is worsening, that you listen to your body and that you not be afraid to seek the medical care that you need at that point.
My message that I send it everywhere in the space where I speak is the population to go to the doctors even when they are healthy, not only when they are having a problem, because it's important for you to understand that your health is a priority. You need to take care of your body. You need to take care of your health, and you can do that only in partnership with the specialists.
One thing that we didn't specifically talk about, I guess, would be the importance from a policy level of thinking about what we virus testing and eligibility for testing. So currently, testing may be limited. And for example, influenza testing is hard to get outside of hospitalized settings in many places. We saw the importance of testing during the COVID pandemic and how people used testing to modify their behaviors. So it's been demonstrated that these tests, if they're available, can be helpful. And so ideally, as we're better able to specifically prevent and treat viruses such as hMPV, including them in testing that's more accessible and routinely used would be really valuable.
Thank you to all our guests on this very important episode featuring a patient, caregiver, and healthcare provider perspectives. As we have heard, hMPV, among other infectious respiratory diseases, places a significant burden on the physical health, quality of life, and social well-being of at-risk individuals, such as older adults and those with chronic conditions. Specifically, as respiratory diseases are on the rise, significant challenges are placed on individuals, which often limit their community mobility and social engagement. Further, our guest speakers have emphasized the importance of integrating patient voices and advocacy, knowledge translation, and policy efforts to provide the most meaningful outcomes. As public health work is informed by patient and person-centered experiences, interventions can become more reflective of patient needs and address existing gaps. Finally, our guests have highlighted some key actions as we face the respiratory disease season this year and years to come. This includes continuing to engage consistently with healthcare providers, asking questions about testing and treatment options, and continuing to connect with local patient organizations to provide relevant and timely information. Tune in to episode 3, which will take a public health focus on the impact of hMPV. IFA would like to thank Sanofi for supporting this series. To find more information on this episode and view associated resources, visit vaccinesforlife.com. To join the conversation and continue the dialogue on hMPV, follow, like, and engage with us on social media.